Hey RT, we spent a lot of time talking to employers, and I think people kind of wonder what we learned. So tell me something you learned from an employer this week.
Well, generally when we put pre-med and pre-PA students in front of employers for clinical jobs, the feedback we get is really positive, right? They're engaged, they're professional, and they come across, that they really are interested in the position. We did have one conversation this week that I wanted to highlight. This was a community health position, and it was interesting. They interviewed 5 pre-med and pre-PA students for the job, and all of them got turned down for the position.
And what was the feedback you got in terms of why? Was it that they were not good fits, or was it how they presented themselves? What happened in those interviews?
So oftentimes pre-med and pre-PA students are worried that it's a lack of experience is the reason why they're not getting the job. But that's not always the case. And in this case, it really was more about how they conveyed their level of interest in the job.
And what is it they said or did that kind of maybe turned off the employer?
So the biggest bit of feedback we got is when they were asked, why do you want this position? Universally, they led with, well, I need patient-facing hours for my application. Now, yes, you do need patient-facing hours for your application. But as an employer, what you're looking for when you're interviewing someone is a genuine excitement about that particular position, not just, I need a job, so I want a job.
And what do you think that could sound like if we were to give advice to a student, or like, this is sort of a better way to present that? What could they say?
Well, I think you put what you're looking for in the context of that position. So for instance, I'm at the start of my career. I'm really looking to interact with patients in a care environment. Can you talk to me a little bit about what that looks like for a medical assistant in this practice, right? That shows that you're interested in their particular position, but it also helps you to answer the question for yourself, am I going to be engaging in patients in a way that makes sense for me?
And I think in summary, this comes up a lot with pre-health students, this sort of checklist mentality of like, these are the things I need to do. And you can't really enter an interview with a checklist, right? They're more interested in kind of putting the right person in the role who's going to care about their patients. And so you do have to lead with, these are the competencies and skills I hope to develop. And this is the type of care I hope to deliver.
I think one key takeaway from this conversation is you really need to focus when you're in an interview on not just, you want to convey that you're excited about that specific position and the experience you're going to get it, as opposed to, I need a job and so I'd like this job.
Nobody likes to feel used is kind of the other thing. So you never want the employer to feel like you're just using them to get somewhere else.
That's right.
They know they're interviewing pre-health students. They've seen your resume. They know you're planning to leave from that school or PA school, but they really want to know how you plan to grow in that position and what you plan to give back to that position. So it needs to be both of those things.
That's exactly right.